A healthy weight can be key when it comes to helping to prevent many diseases. And here with a medically supervised way to help lose critical weight is aesthetic medicine's Dr. Jerry Darm, along with his patients Rick and Kathy Webb. Good to have you all with us.
Good morning.
So Dr. Darm, explain first, though, how the weight loss program works.
Well, it's medically supervised, and many of the patients opt to take a food holiday. They go away from food for a while and just use the diet shakes, and the weight comes off very, very quickly and effectively. In essence, the appetite goes away when you're in this program, which is why the average patient loses about 40 to 60 pounds.
When you say a food holiday, how long is that holiday?
3 to 6 months.
Is it, okay, but it's not, what are you doing for nutrition then?
Well, the shakes are nutritionally balanced, and so you get basically everything that you need. So, you know, and you really you get healthier when you're on these shakes than when you're on, you know, the American diet.
Gotcha.
Rick and Kathy, let's take a look at your before pictures, your before and after pictures. Incredible. So, and let's start with you, Rick, since we see your before and after picture right there. What was the whole process like for you?
You know, you go onto the shakes, you start losing weight. I think I lost 10 pounds the first week, or pretty close to that, and it just sheds off every week, and it's really easy.
Were either of you having medical conditions because of your weight?
I have been a diabetic for probably 5 or 6 years now. I was taking an incredible amount of insulin every evening, and I think it was like 5 shots a night.
Oh.
Now I'm taking a half a shot a night, and I'm actually even better as far as my numbers. I'm actually down in the 80, 85 range that you're supposed to be.
You know, Kathy, I can understand why a couple might want to try a program together because it's easier, but tell us, how much easier was it to do a weight loss program with your husband?
Actually, it made it super simple. First of all, the program is really easy. It takes away all your choices because you're drinking your meals. But I couldn't do it without doing it with my husband, just because there's no food in the house. It takes away...
No temptations. Let's look at your before and after pictures. A remarkable picture here. We'll pull those up. And how much weight did you lose?
I lost 37 pounds.
Wow.
Looked great.
So how do you feel now? How has life changed for both of you? What can you do now that you didn't used to do?
Cross my legs.
It's the little things.
And how do you feel, Rick?
You know, I feel great. It's not only is the diabetes a lot better, but I had arthritis signs coming on fairly heavily. I had a real bad knee and a hip, and the loss of weight, I don't even feel those anymore, which is awesome.
And Dr. Darm, why is it so important to be medically supervised while you undergo a program like this?
Well, we do lab tests every month. We do an EKG before they start, and for example, in Rick's case, you know, you have to monitor the levels of insulin and so on, and those have to be dropped very quickly. In other words, you got to make some changes. So that's why it's so important to medically
That's a really good
supervise,
point, because as you mentioned, your medications change, and if you were just doing this at home on your own and your medication level changed, you may have been over-medicated at some point.
Correct.
Yeah, that's
Now,
not
what
good.
do they have to do to maintain their weight?
Well, they would do the maintenance program and, you know, continue to take shakes, 2-3 shakes a day, walk 3 miles a day, and then, of course, have, you know, regular visits for the reinforcement that we give during the maintenance program.
Well, you both look great. Thanks for coming and
Thank
sharing
you.
that story. I know it's not always easy to show those pictures, but we appreciate that you did it today. Thank
And
you.
if you'd like to find out more, contact Aesthetic Medicine in Tiger. The phone number is 503-697-9777. We'll put the information on our website for you, too, at k2.com.